Riley. I'm currently in my second residency as a prosthetic resident, and I went to school at Northwestern.
My name is Katie. I'm currently in my first residency as an orthotic resident, and I went to school at Cal State Hills.
I'm Emily. I'm in my second residency as an orthotic resident, and I went to school at Eastern Michigan University.
My name is Connor. I'm a first-year orthotic resident here at UCSF, and I did my education at the University of Washington.
The O&P clinic is located on the 5th floor of the Gateway Medical Building of the Mission Bay Hospital. If fully staffed, there are 3 CPOs at this location. The fabrication lab area is compact yet efficient. This is the primary lab and work area. There's a full-size oven where we can thermoform small TLSOs, AFOs, FFOs, etc. This workbench acts as a vacuum stand and plaster modification area. The primary patient room is home to the Ortho America Star Scanner, where we take scans for cranial remolding orthoses. This room contains all materials needed for assessments, casting, and storage for some off-the-shelf items. This rotation sees both adult and pediatric inpatients. Both hospitals are connected to the Gateway building via the spine. The primary patient population here is pediatrics. There are many unique pathologies that will be treated at this location, including plagiocephaly, scoliosis, pectus carinatum, CP, spina bifida, among others. The Mission Bay Clinic is conveniently located down the hall from the orthopedic department. We often are involved with specialty clinics including ortho, craniofacial, spina bifida, and pediatric inpatient rehabilitation.
The Parnassus Heights Clinic is located right across the street from the main building of the Helen Diller Medical Center. When fully staffed, there are 2 to 3 CPOs, 2 ATs, and a technician at this campus. The entire space is relatively spread out, with 2 offices here in the back, a central space with workbenches, a plaster room, and a machine room. We are fully equipped to fabricate just about any thermoplastic or conventional orthoses. However, we do not currently have the capability to laminate devices at this location. We stock an extensive amount of off-the-shelf items here for use with both inpatients and outpatients. At Parnassus, there are 5 patient rooms, 1 being equipped with parallel bars. This allows for plenty of space to easily handle scheduled patients as well as walk-ins. The outpatient population seen at Parnassus is largely adult dysvascular. You will also see a fair number of patients with stroke, as well as individuals with polio or post-polio syndrome. As mentioned previously, the O&P clinic is right across the street from the main hospital. We see a large volume of inpatients, including those being treated by orthopedics, neurosurgery, hem-onc, and vascular or limb salvage. Most inpatient duties are handled by our very skilled athletic trainers, but occasionally if they need some additional hands, or if there is a custom device that is required, the resident will provide that assistance.
The O&P clinic at CSFGH is located on the hospital campus with a short walk to the main hospital. When fully staffed, there are 3 CPOs and 1 athletic trainer at this location. The office is located directly under the orthopedic department. The office has 3 patient rooms and 1 set of parallel bars. The first 2 rooms are primarily used for custom devices, and the 3rd room has stock for off-the-shelf devices. Overflow stock is kept downstairs in the cage, which is split with other departments. The lab is split into a working area and a machine room. The working area contains all of the necessary foams, materials, and tools for adjusting and finishing orthotics. The machine room has an oven, bandsaw, drill press, Troutman, and shoe machine. The room also contains capabilities for thermoforming orthotic devices. The plaster room and modification room are separate but contain all necessary equipment and tools for modifications. This location sees primarily adults with occasional pediatric patients. This is a level 1 trauma hospital with high rates of traumatic injuries seen for inpatients. This is also a county hospital in which we'll see people who are experiencing homelessness, non-English speaking patients which require the use of translators, or have a lower socioeconomic status as compared to other locations within this residency. Other clinics the orthotic resident will typically attend are 3M, 4A, and Laguna Honda. 3M is an orthopedic clinic with both lower and upper extremity. Off-the-shelf and custom devices are seen here. 4A is an inpatient SNF at ZSFGH. Laguna Honda is also a SNF but is off-site with a variety of off-the-shelf and custom devices. The Laguna Honda Hospital Clinic works very closely with the physical therapist at the hospital.
The Orthopedic Institute is located on the Mission Bay campus and houses the Department of Orthopedic Surgery. When fully staffed, the OI office consists of 2 CPOs, 2 CPs, 2 athletic trainers, and 1 technician. We have 5 patient rooms, including 3 patient exam rooms, 1 casting room, and 1 gate room with parallel bars. In the lab, we have 4 workbenches for each of our certified O&P staff and a desk for our technician. We have a machine room where the Troutmans, shoe machine, bandsaw, and ovens and vacuum live. This also houses 2 Milmos for prosthetic alignment. And lastly, our plaster room provides a space for plaster modifications and general fabrication and assembling of devices. The patient population here consists mostly of prosthetics, and so the prosthetic resident spends their year here at the OI. We see age ranges from pediatric to geriatric. Our orthopedic and oncology surgeons perform amputation surgeries at the adult Mission Bay Hospital, where we provide post-operative prosthetic management like iPods. This also serves the resident with the opportunity to observe amputation surgeries as they are scheduled. The OI houses the Human Performance Center. UCSF O&P department collaborates with the HPC on our research projects. Biomechanists and exercise physiologists run the lab, which gives us the opportunity to collect biomechanical gait data, including kinematic data using Vicon motion capture system and kinetic data using force platforms. This also provides the opportunity to utilize wireless EMG and accelerometers and record metabolic and physiological information. The OI also houses physical therapy, which offers the opportunity for the resident to observe PT training sessions and collaborate with physical therapists on patient care. And finally, UCSF is home to the International Center for Osseointegration Research, Education, and Surge. This program consists of IRB-approved clinical trials, which investigates the outcomes and adverse events associated with the implantation of bone-anchored percutaneous prosthesis for patients with above-the-knee amputation. This provides the prosthetic resident with the unique experience of observing and assisting prosthetic management of patients with osseointegration for above-knee amputation.
There are about 3 to 4 ongoing research projects. Each resident is responsible for leading one project, but everyone may contribute at some point during the year. There are 4 hours of research time built into your weekly schedule. However, sometimes things come up or an interesting case occurs that you want to see. Regardless, you may have to work on research outside of normal work hours. A final presentation is given at the end of the residency summarizing the work you completed.
Each resident will give 4 case study presentations throughout the year to discuss pathologies and orthotic or prosthetic treatment. The clinical team also participates in Journal Club through the Academy that occurs once a quarter. UCSF traditionally is involved in a number of community outreach events, including, but not limited to, the Amputee Basketball Clinic, participation in the Bay Area Science Festival, and hosting visiting students.
Residents start on call about 1 month into residency after shadowing at your respective hospitals. Coverage is approximately every 4 to 6 weeks from 8 a.m. to 5 p.m. on Saturday and Sunday. Residents will cover at least 1 major holiday.
There is an option to live in student housing with multiple buildings and units spread across the city, with 2 located in close proximity to Mission Bay Hospital. Student housing requires an application and proof of employment. There is no shortage of apartments, condos, or other housing options in the city if you choose to pursue those. Alternatively, you can commute from East Bay or South Bay via public transit or car, but it's important to know that it can be a long commute with expensive parking. Other ways to commute within the city include the UCSF shuttle service, which offers transportation to all of the clinics. It is free but does not run on the weekends or holidays. You could also bike, take the SF Muni, or scooter. We hope this virtual overview of the UCSF Orthotic and Prosthetic facilities helped you visualize our clinical space and some of the logistics of living in San Francisco.